Hello, I am Karuna and you're watching Patient Education series on cancer. Today, cancer is no more a disease of developed nations only. There are 7 to 8 lakhs new cancer patients every year. Cancer amounts for 8% of deaths in India. But still, each year, over 2 lakh cases of head and neck cancer are registered in the country. This number can be changed with awareness, early detection and preventive measures. To achieve this goal, I welcome you once again to Patient Education series on cancer. Today we will know all about head and neck cancer from a renowned expert, Dr. S. Krishnan, oncologist, Srinivasan Rajalakshmi Memorial Hospital, Chennai. Let's welcome Dr. Krishnan. Doctor, welcome to the show. Doctor, what are the cancers of head and neck and what do they include?
Head and neck cancers comprises of a complex group of cancers. It can arise from muscle, skin, mucosa and the organs in the head and neck. The most common cancers of the head and neck include cancers of the cheek, alveolus, which are greatly due to the tobacco chewing in India. Then the cancers of the tongue, cancers of the pharynx, larynx and cancers of the nasopharynx, which is very common in younger age group, and the maxillary sinus. It also comprises of cancers arising from the salivary glands in the head and neck region, and lymphomas, melanomas and other cancers also do occur in the head and neck region. But the most common cancer of the head and neck is a squamous cell cancer, which is due to the abuse with the tobacco.
What are the risk factors for developing head and neck cancers?
The most common cause is smoking tobacco. Though smoking tobacco is also an important cause in India, the chewing tobacco forms a very huge chunk of patients who come in a very advanced cancer. Particularly, we see that the modern ingredients in the preformed tobaccos which are marketed cause very aggressive head and neck cancers. The other common causes include unattended teeth problems, a chronic irritation on the mucosa, and this is the main reason, along with the certain virus. We know now that certain viruses can be very important in head and neck cancers, particularly the human papilloma virus, and fortunately, if that is the etiology of this cancer, the patients seem to be cured well. So, though the virus is playing an important role, it becomes a curable problem, whereas the tobacco plays an incurable problem.
Doctor, how is head and neck cancer diagnosed?
The head and neck cancers are diagnosed a little late. People ignore the symptoms. The reason why the cancer symptoms are ignored, or cancer symptoms at the beginning, are no different from the other common disease of the area. So, when they have a problem in the mouth, it is commonly an ulcer, a non-healing ulcer, a non-healing swelling in the neck. A swelling in the neck, ulcers in the mouth, changes in the voice, change or difficulty in the method of swallowing, a block in the nose. These are the very common symptoms with which the head and neck patients predominantly present. This symptoms, when the patient approaches the doctor, if it is not healing with the routine treatment, then the doctor goes for the further investigation. The important step in diagnosing a cancer is taking a biopsy. The biopsy of the head and neck region can be performed very easily as long as it is in the oral cavity. When it is in the nasal cavity, we need a scope. When it is in the pharynx, we need a scope. So, these scopes are done under anesthesia and a biopsy is taken. Sometimes it is not uncommon to see only the swelling in the neck. and this swelling in the neck proves to be a cancer, then a thorough search is made which part of the head and neck this head and neck cancer is arising. We have sometimes never been able to find the origin of the cancer, only see the swelling in the neck. The swelling in the neck represents the lymphatic glands. The second step in staging this cancer is by doing imaging. The modalities include the CT scan or an MRI. The PET scan has still not been confirmed as the method to stage the head and neck cancers, but still it is very useful to locate the metastasis. The scan is done at a very thin sections. It is always done from the roof of the nasopharynx till the lower neck, because some cancers of the head and neck, like the cancers of the nasopharynx and tongue, spread enormously into the lymph glands. The critical thing is now the biopsy and the scan and the physical examination to stage the cancer. So once the cancer is diagnosed, it is staged so that it is suitable for a correct and appropriate treatment.
What are some recent advances for treating head and neck cancer? What is meant by targeted therapies?
This means that the patient should know what is meaning of the non-targeted therapies or the chemotherapy. The chemotherapy works by targeting at any dividing cell. That means any cell in the body which is dividing will be attacked by the chemotherapy drugs. Now this is what is producing the most undesirable effects of the hair fall, loss of the blood counts, loss of the mucosa, diarrhea, and serious complications of chemotherapy. Now it has been a desire of the medical fraternity and researchers to find drugs which will work only for where they want. So the targeted therapy means the drugs which will go and attack only the target. So for which the cancer cells were thoroughly analyzed. For example, we are talking about the head and neck cancer. There is an EGFR. This EGFR is a surface membrane antigen of the cells, which is expressed in majority of the head and neck cancers. Now, this expression means a cancer cell, when it has an EGFR mutation on the surface, it divides very fast. This gives signals inside the cell which make that cell behave as a very bad cancer. Now, the scientists now understood if anything could be done, the head and neck cancer, we have to do it to this EGFR mutation. So we have now modern drugs which target and goes and gets attached to this. So now you understand that there is a hole, and if the hole is plugged, then the seepage is going to stop. This cell has a hole in the form of this mutation. The moment that the hole is blocked, the cell is going to stop dividing and it is going to die due to the radiation or chemotherapy and make the person get cured. So the modern drugs such as the Biomap and Erbutax, they go target this EGFR. We have even drugs like small molecules like Jeftinib and Erlotinib, whose role are yet to be defined in this particular situation. That we have the established molecules, as I said before, the Erbutax and Biomap, they go attached to this substratum. The moment they go attached, they make this cell listen to the treatment. So now you understand that these drugs will not go and attack anywhere else. They will not attack the bone marrow. They will not attack the hair. Though our desire is that we should not have any side effect at all to these drugs. Some of these drugs do have side effects in some regions like skin, causing some rashes. But majority of these drugs are very safe to use and they have no serious complication unlike the chemotherapy.
What is the role of a caregiver when a loved one is undergoing treatment for cancer?
It's very important, because unless we have somebody to support, we can never do anything. This is most true in the head and neck cancers, because I have not mentioned to you about the complications. The complication, one of the main complication is because mouth is the entrance to the body. When the mouth is affected, one person cannot eat, he cannot speak. So two things happen, he cannot eat, he cannot communicate. When those things happen, only a loved one can really make him feel and give all the comfort. And someone has to make him follow the doctor's advice. One of the common things we advise is to keep the mouth very clean. Many patients who come in the little advanced cancer may require feeding through the nasal gastric tube. So when we give the NG tube feeding must be done by the loved ones. So loved ones have the role in feeding these patients, giving him a reassurance that they are going to be all right, and taking care of their moral and physical needs and make the treatment successful.
Thank you, doctor. Thank you so much for being with us. Friends, today we discussed about a very dangerous form of cancer that develops in the head and neck. We will keep updating you about other types of cancer in our further episodes. Till then, eat healthy, be alert and live a safe life, क्योंकि हमें आपकी फिक्र है.